The broadcast is now starting. All attendees are in listen-only mode.
Hi, everyone. Thank you so much for joining our Chest, Women, and Pulmonary webinar today. Today we have two wonderful guests, Dr. Rosie Khan and Dr. Anissa Das, who are going to be talking about being an advocate for yourself. I want to extend a very special thank you to our funders who made this program possible today. AstraZeneca, Boehringer Ingelheim, Genentech, and Chest have all been amazing supporters of this program. And I'll stop there and have Dr. Anissa Das introduce herself.
Thank you, Chloe. My name is Anissa Das, and I am an associate professor of pulmonary critical care and sleep medicine at The Ohio State University in Columbus, Ohio. And I think Rosie and I have known each other now for, gosh, a couple of years, right, Rosie?
Yeah, it's been about a couple of years.
Yeah, I think, yeah, but and we were on several task force and focus groups and committees together, but this is our first joint project. So I'll let Rosie introduce herself.
Yeah, I'm really excited. I'm Rosie Khan, and I'm an assistant professor of clinical medicine at the University of Southern California in Los Angeles. And we're really excited to be talking to you about this. And Anissa and I met, I guess, at a chest conference a few years ago. And this is just something that both of us are passionate about. And we've spoken at several chest conferences about topics like this, women in medicine. So we're excited.
Great. Well, we are so excited to have both of you on, and we'll go ahead and start with Dr. Khan's presentation.
All right, so you guys should follow me on social media. That's my Instagram handle. And so basically advocating for yourself is what we're going to be talking about. And women in healthcare face many challenges like delayed academic achievement, unattainable leadership opportunities, and pay disparities. And I believe that the best tool you will ever have is knowledge. So if you know that you're going to be treated in a certain manner because of your gender and gender bias in society, then you can be better prepared to fight, your initial reaction or what's going on in your environment. And this webinar is not meant to tell you what to do, but rather what we want to do is empower you to recognize subtle workplace disparities and give you tools to advocate for yourself and negotiate for yourself. Many women don't claim that they experience anything that's, full on gender discrimination. No one's going to come out to you and say, you can't do this because you're a woman. So sometimes it's difficult to identify when you confront this. You can't put your finger on it, but something is happening and it's not to your favor. And certain opportunities may continuously go to the men in your department. Studies have shown that women don't negotiate as much as men, and it may actually be contributing to the gender gap in salary. There was a classic study that came from Carnegie Mellon University and found that while 57% of men negotiated their first job contract out of college, only a measly 7% of women did that. And that's a pretty shocking difference in number. That's 50% difference. Dr. Linda Babcock, she's one of the authors of a book called Women Don't Ask, The High Cost of Avoiding Negotiation, basically projected these numbers long-term. So in her book, she created a scenario of two 22-year-olds seeking employment who are offered a starting salary at $25,000. The first student takes that offer, and then the other student negotiates an extra $5,000 and puts that into savings. And then if you compound that with 3% annual raises and 3% interest on savings to the age of 60, you have an extra $568,000. I mean, can you imagine an extra $500,000 just from negotiating $5,000 at your initial offer. You know, that's a pretty shocking number. And I think some of it is because some have argued that it's more challenging for women to negotiate because of the expectations placed on females. You know, men are expected to look out for themselves, they have a family to provide for, and that's not traditionally seen for women. While on the other hand, you know, women are supposed to be more communal, more nurturing, and concerned about others. And when women don't meet these expectations, we can be viewed as difficult to work with or demanding. And from a young age, women are taught that their well-being and success are contingent upon acting in stereotypical ways, such as being polite, soft-spoken, compliant, relationship-oriented. And this is reinforced by media and social cues. And women act in ways consistent with their learning experience. You know, society believes not only that women are nurturing, but that they should be nurturing above all else. You know, you want to appear eager and appreciative of opportunities. However, you don't want to get less pay than you deserve. And we essentially equate taking control back with taking something away from someone else. And there's this internalized guilt that we have to sort of fight. Imposter syndrome is also something that Dr. Das is going to expand on later, but it's a concept describing high achieving individuals who are marked by an inability to internalize their accomplishments and a persistent fear of being exposed as a fraud. And it's not necessarily gender specific, but women perseverate on their insecurities in a very different way. And this is also not specific to our profession, but I think because we're such a high achieving, career-oriented profession and field that, you know, it's sort of compounded in the hierarchy of medicine. You know, one of my favorite quotes is by Maya Angelou, and it's interesting to think that such a strong leader and well-accomplished woman such as Maya Angelou would even think about something like this. But, you know, her quote is, "I have written 11 books, but each time I think, oh, they're going to find out now I've run a game on everybody and they're going to find me out." My first job out of fellowship, I was the only and first female intensivist in my group. And during my first hospital critical care committee meeting, I noticed that the chairs in the room were set up in a circle to surround sort of a lead panel. And there were 3 chairs in the front, and there were 4 of us working that day. And I was the new kid on the block, I guess. I was scared to take one of the front 3 chairs, but because of what I knew about women in the workplace and imposter syndrome, I sort of talked myself out of my fears, and I marched right up to that chair and sat down. And I looked around the room for disapproving or awkward looks, and there was nothing. Everyone else just thought it was normal, and some simply said, "Oh, hi, you must be the new attending." And after that experience, I realized that it really was all in my head, and that I did deserve to be there, and that I was, you know, one of the lead physicians for that committee.
You know what? I totally agree with you, Rosie. I think that's a really good point, that oftentimes we are so afraid to initiate something because we just don't feel like we're worthy of that opportunity. And we as women and we as colleagues sometimes really need to remember to support and empower each other in that. I think there have been so many times when the only reason I even considered applying for a position or for a role in a project is because I was fortunate enough to have somebody to say, "Hey, you should run for that." And it would never have occurred to me that I was qualified to do that. And then I would get it, right? So we clearly are our own worst enemies, and need to not only believe in ourselves, but support each other, because if we are not going to support each other, no one else is going to.
I 100% agree with that. You know, you sort of believe that you have to work twice as hard to be considered half as good, you know, and we just kind of keep working like a bee and not letting people know sort of all of our accomplishments. And it's nice to have other women in the workplace sort of advocate for you and talk about what you've accomplished as well, or provide you with some different opportunities. So I'm just going to go through some coaching tips. What can we do besides changing the entire system? Unfortunately, most of the burden of change sort of falls on us for now. And I hope that some of these tips help you. But in general, like I mentioned before, just being aware of the expectations placed on women, knowledge is power, and give yourself permission to move from a nice girl to a professional woman. And there's a book that I highly recommend called Nice Girls Don't Get the Corner Office. And that resource will be listed for you later on in the slideshow. But, visualize yourself as you want to be, prepare ahead, don't aim for perfection, manage your anxiety, and basically you sort of get comfortable with being uncomfortable, because like Anissa mentioned, you're putting yourself in, applying for a job or something that you feel like maybe you don't meet all the qualifications for, but just get comfortable with being uncomfortable and talk back to that fearful voice inside your head. And recently I sort of advocated for myself without actually doing it myself. At work, I'm not very visible. I frequently skip morning meetings and lectures because of the way that my ICU is structured. I work with a neurology ICU team to co-manage all the patients in the neurosurgical ICU, and therefore I'm present during patient rounds in the morning, and that overlaps with meetings and lectures with my department. And at some point, I sort of noticed that my director felt that I was somehow maybe more disengaged with the department. And, sometimes she would make joking comments like, well, I haven't heard anything bad from the nurse manager, so I think things are going well. And I felt uncomfortable sort of bragging about all the new changes and improvements I implemented in my ICU as, one of the new co-directors. Although I did try to give her concrete points and changes that I did, here's what I've done, here are the results. But somehow I could feel that I wasn't really communicating that as effectively as I wanted to, because it just felt so awkward. It's hard to put into words how much your nursing staff loves you without sounding like a complete weirdo. So one day I talked to my nursing manager after a meeting, and she was giving me such nice compliments and telling me what a great job I was doing and thanking me for being so available to the unit. So I said, hey, do me a favor, would you just shoot my director an email with some feedback about my, some of the changes that I've made? And I think she would really like to hear from you, since you guys have worked together for so long, and I know that she trusts you. So my nursing manager obviously said, of course, and sort of laughed at the fact that usually we reach out to directors and managers when things are going poorly, but rarely give any good feedback. And so after she sent this email, my director's attitude towards me completely changed. There was an immediate improvement in her trust levels with me, and it felt really good to finally sort of be recognized. And that's how I kind of advocated for myself without doing it directly. And that kind of falls in line with what Anissa said, is that we can be each other's best advocates. Another good tip is to practice negotiating at a swap meet, or that kind of helps you get a little bit more comfortable with doing face-to-face negotiations. But honestly, you don't even have to do negotiations in person. I negotiated my first contract out of fellowship with an email that basically said, hey, this sounds like a good opportunity, but is there any way that we can make it a great opportunity? And I only did this because I knew that I shouldn't take the first offer.
I think that's a great story. I would never have thought of wording it that way. I think, Rosie, what you did there that was really profound is that you left it open to give them an opportunity to come up with something to make it better. And I think that's sort of one of the faults that sometimes we come up with, is when we hear the word negotiation, we think I need to ask for more money. And lots of places, salaries are sort of locked in. So that may not be a negotiation option. It may be some places, so it doesn't mean that you shouldn't ask, but that may not be something that's negotiable. So think outside the box, right? So what could you do? What could we do to make it better? Or is there any way that we could be creative to find a way to protect some time in my first 2 years? Are there any directorships that would be potentially available to me? Is there going to be additional nursing support in the future, or nurse practitioner support? But asking for things that you might not otherwise realize that really are going to buy you time to increase other opportunities and to do other work, I think, and be creative about what you ask for.
Exactly. Yeah, that is so spot on, because it's not always completely about the salary. There's other things that might be important to you, like you mentioned, protected time for charting or research time, and you can leave it open if you feel uncomfortable just talking straight numbers, and then and sort of figure out what's important for you, and then just kind of shoot them an email instead of doing it over the phone if you feel uncomfortable.
Well, and in private groups, even talking about maternity leave. I mean, I had a girlfriend who was an orthopedic surgeon, and they were going to say that she could not get paid maternity leave beyond sort of what they had, and they said, no, we wouldn't do paid. And her argument was, well, how many of you are going to get, she was in a group practice with a bunch of 60-year-old men, and she's like, how many of you are going to get your knee replacements? Are you going to get paid during your knee replacement? So she ended up getting her maternity pay. But so little things that you might not think about to really ask for and to stand up for yourself.
Yeah, and I like that she used that, because she recognized ahead of time that there was already a bias going on. And so she was able to jump into that conversation knowing that she was going to need to fight for this or negotiate this. And so just having that knowledge to think of an example, like, well, you guys are going to have knee replacements, or, whatever it is, to be able to combat that. The worst thing is when you're just kind of dumbfounded, and later on you're like, wow, I really think I was treated unfairly because I'm a woman. And so just being prepared and knowing that is sort of the best thing that you can do for yourself. The most common way people give up their powers by thinking that they don't have any. And so I would definitely say the most important thing is to be really proud of yourself. Take a moment to give yourself a pat on the back. You're an amazing doctor, healthcare provider. You've worked extremely hard to get where you are, and you definitely deserve to be recognized for that. And with that, I think
awesome.
Dr. Dot is going to start her section.
Yeah. So I am not an Instagram girl. My Instagram account would not be exciting to anybody. It's mostly filled with kids' pictures of fishing. So, but my Twitter account is actually a little bit more professional, and I do tweet a lot about the Sleep Medicine Network for ACCP, recent pulmonary critical care and sleep research, and a lot of women in pulmonary kind of things. So if that's interesting to you, then feel free to follow me. And I think I don't quite have access to the slides yet. There we go. Okay, great. So I'm a little bit goofier than the average person who talks. So my first slide is Stuart Smalley. And I grew up in the 80s. So Stuart Smalley had these sessions where he would look into the mirror and he would do self affirmations. And I think it's funny that your last slide was talking about basically the exact same thing that my first slide's talking about. But I think that this is really important because we are our own worst enemies, and we have to remind ourselves kind of on a daily basis. And I don't say it just like this, but I do remind myself that I'm worthwhile, and saying something like, I'm good enough, I'm smart enough, and doggone it, people like me, to believe in ourselves, right? I mean, we don't need to look in the mirror and be that way, but I do think it's important to really think about this on a regular basis and believe in ourselves, because if we don't believe in ourselves, I'm going to guarantee you, and this is what my dad told me every single day in high school, if you don't believe in yourself, Nobody else is going to either. You have to start on your own and show them that you're worthwhile and show them that you're worth believing in, because you're not believing in yourself is very visible. I think the first step, so my portion of this is a little bit more about how to sort of launch your career and making sure that everything that we are doing in our career is purposeful. And I say this because I didn't always do this, and I'll kind of tell you some of the shortcomings that I think I've had and what I could have done to expedite my career and what I still do wrong. But I think the first step is you need to identify what your goal is and where you're going. What do you want to be doing? And then once you figure out, I want to be the world's best critical care doc, I want to be a division chief, whatever you decide you're going to be, then you figure out what are those steps that you really need to be able to achieve that. If you're in academic medicine, equally important is very early on, and the people who are my current mentees, I tell them this within the first month of them coming in. We need to figure out what the best promotion track for you is. They're different at different institutions, but in general, there's a research track, a clinical excellence track, the traditional track, which is sort of a gamish, and then the clinician educator track. And the reason I think this is so important is not only did I not do this, so I just assumed I was going to be traditional track, and I didn't pull up on our website what the steps and the criteria were. And then 4 years in, literally I waited 4 years, which is so ridiculously embarrassing. I found out and pulled it up and met with my mentorship panel and found out that, you know what, I'm almost all the way there for clinician educator. And I realized how many publications I needed and really what the metrics were to reach promotion to associate professor. So I think first and foremost, you need to figure out which track is best for you. And then whether you're in academic medicine or not, you need to have a clear vision for your future. You need to figure out what your goal is. And then once you choose that goal, establish a plan, and goals can be different and goals can be fluid. And so what works for you when you first finish fellowship or while you're in fellowship might be very different than what works for you when you're my age. So I went into pulmonary critical care and sleep because I was a critical care junkie. I was known as a person who loved to be in the ICU. If I wasn't managing an event, I was not alive. And now my career has evolved to doing like a 90 to 95% sleep medicine, which I think anyone who knew me years ago would never have expected that. But it's sort of where my life took me. So not only is it important to have a clear vision, but it's important to understand that it's okay for that to be modified and for you to reflect on it on a regular basis. I think that, whoops, I gotta keep clicking at the right spot. You have to make sure that you have some form of focus. I think some of the best advice I was given was don't just be a generalist. And by a generalist, that doesn't mean you have to specialize, but that means you have to have something that you are known for. That could be that you're a great physiologist and you can understand CPETs really well. You might be really good in perioperative evaluations. You might be really good at certain procedures, but have something that you are feeling that you are known for, and then you can build your clinical career or your academic career around that. And then I think you need to have a 5-year plan. You have to figure out, okay, and I pick 5 because 10, I've already proven that 10 years things can change, but 5 years is a reasonable time. Figure out where you want to be. What achievements do you want? Do you want to have achieved a certain amount of funding? Are you in research? Do you want to be in education and being able to really develop curriculum, whether it be for students or fellows or, at a national level? Do you want to be a research team leader? Do you want to, what titles are important to you? Do you want to be section chief? Do you want to be medical director of an ICU? Do you want to be holding a leadership role in a national committee? These are super important because once you figure out what these goals are, you need to reflect and then plan how to get there because they really take some time. And then you break it down into annual goals so that you can make sure that you're on track to achieve that. And then along with those goals, you need to figure out what are your strengths. So what am I good at? I might really enjoy these things, but if I'm really good at detail orientation, maybe I should really be coming up with protocols for my sleep lab or protocols for the ICU. If I am confident in speaking publicly, maybe I should really be focusing on education or creating new innovative ways to disseminate education. And at the same time, what excites you? Because let's face it, if you are excited about what you're doing, it is so much easier to do things on a daily basis. And then once we figure that out, is what can I do to achieve these goals, and what skills am I going to need? Am I going to need to get more education on how to teach? Am I going to need to get some more procedural education? Are there additional courses I need to take so that you know along your 5-year plan and your annual plan what things you need to do? I think that sort of brings me next to something that has really become more aware to me probably in the past 2 years than anything else. I don't know how many of you really think about the difference between mentorship and sponsorship, but they are tremendously different. That's not to say that a mentor can't also be a sponsor, but they're very different and both are very equally important. And I'll sort of tell you my thoughts about sponsorship in just a bit. So the difference is a mentor is somebody who listens to your goals, and when you tell them what those goals are, they're going to provide advice to you on not only how to achieve those goals, but really whether those goals might be, reasonable. A sponsor, while they're hearing your goals, they are going to seek out new opportunities that really may even be stretch opportunities. And then when they see those opportunities that think would be a good fit for you, they're going to support you and they're going to recommend you and bring your name up to create opportunities for you. A mentor is really a one-on-one relationship. They are going to provide this one-on-one guidance to you on a regular, formalized basis. Whereas a sponsor, which is much less formal, is going to connect you with other folks who are really in a very similar situation and circumstance as you, and is going to support all of you in achieving your success by promoting opportunities for you. And then finally, a mentor really is going to give you perspective on your career ambitions. Are these in line with what your goals are in life? And is your timeline reasonable? And what steps do you need to encounter to achieve those ambitions? Where as a sponsor, we'll say, okay, I understand what those career ambitions are, isn't necessarily going to be providing feedback on that, but is going to advocate for you, whether it be within a hospital, within a group, or within a national organization, to really get you opportunities to get to your career ambitions. Different but equally important. So a mentor is a formalized relationship. You seek out a mentor. You are going to, when you start a new job, find somebody and say, hey, would you be willing to be my mentor? It's going to be a relationship where you meet on a regular basis. You go over all of those goals that we talked about, over the skills. Annually, you want to make sure that I'm the queen of the checklist, for goodness sakes. You want to make sure you're meeting those checklists. And they can provide for you sort of the next steps and ways within your area of interest, other things you might do to sort of launch your own career. A sponsor, as I talk about sponsors sound great, right? They give you all these opportunities. Doesn't that seem awesome? So you're like, how do I get a sponsor? Well, sadly, you don't really get to choose a sponsor. A sponsor typically chooses you. And the bottom line is I didn't realize, so this is why I say I didn't really understand what sponsorship was until I found out retrospectively that I was getting all these opportunities And somebody sort of explained it to me. They're like, well, that's because these people are sponsoring you. I'm like, what do you mean? So I had encountered these amazing women in the past 5 years who were so generous with their time and their talents and their advice. But what I realized was, more importantly, behind the scenes, when opportunities came up to help author books or to be teaching on international courses, I was realizing that I was getting these opportunities sort of coming my way. And in retrospect, found out that it was really, and it wasn't just women, I should be fair, it was men and women. I've had amazing sponsorship of both genders. But it really came down to probably 4 or 5 people who have really been silently promoting me in the background. I don't know if you've had any experiences in sponsorship and mentorship, Rosie?
Yeah, actually, I was going to mention, sometimes depending on your career goals, like you said, you want to map those out. You may not be able to find a good fit for like a mentor or someone to sponsor you locally. And that's kind of one of the challenges I ran into. I'm a little bit quirky in that I'm an intensivist, but I like neurocritical care. And I'm obsessed with social media and advocating that for medical education. And so I have this really weird pocket, and no one really at my institution could help kind of guide me. And that's sort of how I got more involved in the CHEST organization. And I met my sponsor, Dr. Chris Carroll, at one of the CHEST meetings, because we were tweeting to each other and having discussions. And then, he pulled me on to the social media task force. And since then, we've had a really great working relationship. We've published a lot of social media abstracts together. And then recently at this last CHEST conference, he invited me to a dinner and introduced me to, lots of CHEST leadership. And he's basically opened up the doors for me to grab these opportunities and unique little pockets that my institution wasn't able to provide. So I would definitely encourage people that if you feel a little bit lost locally or at your institution, see if you can expand out to the CHEST organization and join a committee where you think that that would highlight some of your strengths, and then someone is going to recognize your enthusiasm for that particular thing that you like, just like Chris did with me. And so that's sort of how I ended up getting my sponsor.
So you basically just totally illustrated exactly what I would say. So I love it. That was perfect. So while we can't necessarily request somebody sponsor us, in fact, that would probably be a faux pas and a little awkward. What you can do, right? So I don't have, a sponsorship isn't formal. Mentorship is formal, but what you do is you can say, okay, you know what? These folks really are in line with my interests. These folks have really been supportive to other people's careers. And then the next step is exactly what Rosie said, right? So you seek out opportunities to work with them, whether it be joining a task force, whether it be being on a hospital committee with them, whether it be volunteering to give a talk with somebody even. I mean, one of the people who's probably been my greatest sponsor, I met because I was thrown into a talk with her. And I remember being horrified because, of course, imposter syndrome set in. And I was like, I'm totally not worthy to speak with this woman. But the key is once you have that opportunity to get exposure, then you do exactly what Rosie said, which is you perform and you get it done well. You just got your window to showcase your talents. So gosh, do not waste that opportunity. Put 120% in, give it your best shot, and make your value visible to them. Once your value is visible, they're going to say, huh, you know what, that Rosie Kahn, I like her. I really want to work with her again. I'm gonna recommend her for the next thing I do. And then if that's what you want to do, you need to make sure that your career goals are clear and that they are known to folks, because you want to let them know what opportunities are really going to be exciting to you so that they know what to advocate for you for.
Yeah, being vocal about your goals and what you want, and just letting them know, hey, if this comes up, I would love to get involved in that, or, you know, whatever it is that you're passionate about.
Yeah, absolutely. So this is the other piece you were saying. So really sponsorship and mentorship, honestly, for that matter, because you can have an external mentor external to your institution. It really kind of feeds off of your professional network. And what I couldn't say enough is build your professional network early. And really, to build a professional network, it goes back to believing in yourself, right? It goes back to sitting in that front row like Rosie Kahn did, and making sure that we feel that we are valued and we belong there. That includes showing up to faculty meetings and institutional meetings. And Rosie, I am just like you. So my clinic is in the suburbs, so it is really hard for me to get to faculty meetings. That's my biggest fault, to the point that my supervisor is like, nice to see you here, Das. And I'm like, oh gosh. So I do think that's another one of my current failures. It's really important to make your face seen and make your voice heard, because if people don't know about you, then they can't advocate for you, and you can't advocate for yourself. At the exact same level, do it at the regional and national meetings. You know, so CHEST and ATS and SCCM and SLEEP, these meetings have anywhere between 5 and 10,000 people at them. I am going to tell you, the far majority of people are going to walk around, head down, go to sessions, learn great content, and leave, and have missed an entire opportunity to network. So I advise you, get up, ask your question at the end of a session. At the end, walk up to the speakers, introduce yourselves. Even though that's not going to make a huge impact first, you can always follow it up. So let's say the next year you want to submit a session, and submit them as one of the speakers with you. Then you say, hey, you know what? I met you last year. You did a session on X, Y, and Z. It was so fantastic. When I met you, I was so excited by what you said. I'm submitting a session similar this year. Would you be willing to speak on my session? Not only do you now have a connection, heck, if that session gets accepted, now you're speaking with this person. What a great opportunity to expand your professional network. And I can't say enough. So joint projects and social media. Social media is a huge way I don't think we think of very often to expand our professional network. Instagram, Twitter, Snapchat, LinkedIn. These are all resources that docs are on, and it evens the playing field. So whether you're a medical student, you're a resident, you're a fellow, or you're a faculty member, or you're the world-renowned ultrasonologist or you know, or critical care specialist, you are all the same playing field on Twitter. You know what? That med student might have 20 times more Twitter followers than the researcher who's well known. It's true, right? And they're more famous. And it's what's interesting is now that playing field is leveled, there's a conversation that's held at a very cool level, and we're all sort of talking as equals. My personal story. So, you know, Rosie, you had mentioned that your career was in part expanded by your work with Chris Carroll on social media. So I had followed a woman on social media, and she actually said she's actually a dean of women's health, and I had been following her for some time. She's in sleep medicine, and then I went to the sleep meeting. She gave a talk on diversification and gender disparities. I went up to her and afterward emailed her and said, you know, we're Twitter followers of each other. I went to your session. I loved it. Well, we put together a session after meeting. We decided to put a group together. We put a Twitter session together for this next year's meeting in that organization, and are speaking together. So now I have
That's
4 new
awesome.
colleagues that she and I have never met face to face, but we have been on phone conferences. We've created a task force, and this all started with Twitter. So social media can really create opportunities that I don't think people think about.
Yeah, I totally agree. I mean, that's how I've sort of gotten very involved in the CHEST organization, is through what's Twitter, just tweeting at a conference.
No, you're exactly right. Tweeting at conferences, oh my gosh, and using the hashtags from the conferences, you will then, when you meet people, they know who you are. I mean, there were so many people who I met actually at CHEST this year who came up to me because I do a decent amount at chest, a decent amount within sleep. And they came up and like, I've been following you for a year. Nice to meet you in person. And you know what? And actually, one of the people who did that, so this is another opportunity. One of the people who said, I think I follow you on Twitter. I actually ended up putting him in one of my sessions, and now he and I are speaking together this year. So it really does make a big difference. So here, this is interesting. I saw this quote and this recommendation actually on Twitter as well, as it were. And it was this quotation about a much larger percentage of men show up to meetings early. And by meetings, I'm more talking about hospital administrative meetings, but it could apply to anything. And women are all running in at the last minute. And the difference is when you show up early, you network, you make friends, you can win allies, you can advocate for yourself. You're making your thoughts known before you have this large audience in sort of a smaller group setting. So make an effort to show up and make an effort to speak up, even if it's one small thing, and don't be afraid to sort of speak your mind. I think I still to this day get afraid to speak my mind, which shocks people because I talk nonstop. But I think on that line, it's so important to remember that early on in your career, do not be afraid to say yes. Even if you're worried, a lot of people say, how do I say no? How do I learn to say no? Early in your career, I'm going to argue you shouldn't say no that often. And Rosie, I'd be really interested if you have different thoughts on that. But my thought is early on, say yes to as much as is reasonable and that's interesting to you. Because I think that these smaller opportunities can always create more opportunities. And the problem is oftentimes we don't say yes because we don't think we're worthy. And I know that you talked about this earlier, but I love this little vignette. So the concept of imposter syndrome is, I feel like I know this little bit in the blue circle, and I'm convinced that everyone else at the table knows so much more. And if you have never experienced this, gosh, I am so jealous of you, because I feel like I experience this at least once a meeting, if not at least once a week. But the reality is that what others know is the exact same amount as us, but their spheres of knowledge just overlap ours. So it's absolutely right. They may know something far more intensely than we know, but there's other pieces of knowledge we have that they have no knowledge on. So you need to remember that this vignette, when you're afraid that everyone else knows more than you, there's other pieces of knowledge that you have that they don't. So I think sort of in wrapping it up, I think I just have a couple more slides here. Get involved. And Rosie said, and if you have other thoughts on this, I'd be happy to hear. So national committees, there are, I will tell you, so I am on the other end of it, when people are submitting to be on CHEST committees. I'm one of the ones who vote for sort of the Sleep Network, at least, and some of the other committees. You would be shocked at the low numbers for some of the committees that people apply for. Sometimes we have a lot for a low number, but sometimes there's not. If you don't put your name in, you're never going to get on these committees. And if your goal is that you want to be in leadership, gosh, the first thing you need to do is to get on a committee. And if you want to get on a committee, you need to show you've done things. So submit content, make sure people know who you are, and don't be discouraged if you don't get on a committee when you apply. I have a colleague, I remember him telling me he applied to be on the education committee for CHEST, I think 3 years in a row before he got it. And he's a pretty well known right now within CHEST. But he's like 3 years in a row I applied and I never got it. So don't get discouraged. Apply for leadership roles within your institution. In the past 5 years, I've applied for 2 leadership roles that I didn't get. And you know what? That's okay. When they keep applying, I have I have gotten a lot of the ones that I have applied for, but you won't get them if you don't apply, and you have to figure out where you're the best fit, right? Volunteer for projects. When you work on projects, you meet other people and they create other opportunities. That's how you get more publication projects. That's how you get more speaking projects. That's how you get more clinical expertise. So I think all of that is important.
Anissa, I love what you said about don't worry about the rejections, and I would almost even say that you would expect rejections. Even with networking, when I went to the CHEST conferences early on as a new junior faculty, I got rejected a lot of times. You know, people would say, okay, shoot me an email. I would shoot them an email and then I wouldn't hear back. And then I would follow up and I still wouldn't hear back. But I guess it's about exposing yourself and understanding that that is part of the expectation, is that you will get rejected. And I've also put in a lot of lecture topics for CHEST and SCCM, and there's been years where all of my lecture topics have been rejected. And so that's just part of the process of putting yourself out there.
That's a really good point, because especially for a lot of these national meetings, you know, we're picking one session out of 5 or even 10 sometimes. So along those lines, if you all are excited about submitting things, feel free to reach out to other people and ask them to look things over, because there are definitely key things that help things get accepted. Look at what sessions were accepted in prior years. I think that's really helpful. Every meeting has different kinds of topics. Some meetings, as you probably have noticed, have really nerdy and fun, which you can tell that I like that kind of titles that are goofy. Some are very serious and you would never do that. So you need to make sure that what you're submitting is accurate and appropriate for that type of meeting. One of the final things I wanted to say is, along a line of people saying no and getting rejected, don't let somebody who doesn't have the power to say no, or rather the power to say yes, tell you no. So don't let a naysayer turn you off of an idea if you're excited about something. If they are not the person who can ultimately approve your idea, or they're not the person who's going to elect you, then I don't think that they're the person who should tell you no. This was a quote from Eleanor Roosevelt, which I thought was so profound. It's really important to remember, right? I was like, this is phenomenal. I think it's important to remember that. So don't let people get you down. Now that doesn't mean to not listen to advice, right? Advice is important, but don't let yourself get down. And then ultimately later in your career, it really is okay to say no thank you, right? And I think, and this advice actually was given to me quite recently, because I had a whole bunch on my plate and somebody had asked me to do another project. And the key is don't be afraid to say no thank you, but there's right ways to do it, right? So when you're at the point where and that doesn't mean you're saying no to everything, right? But when you're at the point that you're going to say no to something, that is the time to become a sponsor. This is the time to say, you know what, my plate's a little bit full right now, and I don't think I could do the quality of job I would like done on this. However, you know what, I think Dr. Jones would be amazing for this. She has really shown aptitude in this area, and you should consider asking her for this. So anytime you're going to say no, think of somebody that you could advocate for and promote, because in the end of the day, we are all in this together. We have to stick together. If we don't stand up for each other, we can't expect others to. So like Rosie said, I think earlier, unfortunately, this is a culture change, and the reality is it's going to start with us.
Yeah.
Wonderful. Thank you both so much. I'm getting these questions in that are also saying great pearls of wisdom. So thank you so much. I did want to spend the next 12 minutes going over some of the questions that we got in. So one of the big ones that I think you can both have a bit of perspective on is, how do you handle advancement of an academic career and having a family?
I'm single with no kids, so maybe Anissa.
Yeah, so yeah, I'm happy to take that one on. So I have 2 boys, age 13 and 10. And that's part of what I was talking about, the evolution of your career. So I was, like I said, I was the critical care girl. And then I had a little guy, and I am somebody who is pretty intense about whatever it is I do. And for me at that time, I decided that I couldn't be in the ICU as much as I wanted to be able to be there, and still be for my kids as much as I wanted to be there. And this was very personal for me, right? So I modified my career and got more interested in outpatient sleep medicine, and realized, I can be just as intense and make just as much impact in people's lives and do ventilation, but mostly being non-invasive ventilation kind of work. And then that was my first step. So I think step one is don't be afraid to change your focus. And that might mean that you temporarily change your clinical focus. That might mean that you decide, and there's a million ways to make this work, that you decide to have a live-in nanny or au pair. You might decide that your husband's going to be a stay-at-home husband. You might decide that you're going to move somewhere where your family's nearby, right? I didn't have family nearby, and I didn't think I could handle somebody living in my house. So for me, for the first 2 years of my career when I had kids, when I had really little kids, I was actually in private practice and worked 50% time. And so that's where I started. And then I missed academic medicine tremendously, came back full time, and then did that until my kids started school and realized, gosh, soccer practice starts at stinking 5 o'clock and I'm not even out of clinic until 6. So I have switched to 80% full-time equivalent now. This is just sort of my path, so that I can get them to everything they need to do. And now as they're starting to get older, I'm starting to do a lot more travel. I'm starting to get a lot more involved in sort of the national and international education arenas, because I can, because they're a little bit older. So I think knowing that this is a journey. So like my end of the day statement is knowing this is a journey, and don't get frustrated if you have to back off at some point, as long as you are doing good work and making sure you're advocating for yourself. I don't think it's a career death. You absolutely have to make sure you can go to sleep at night and feel like you're doing a good job. And people who say you can't do everything, I disagree in this fact of you just have to make choices, right? You have to make choices about where your priorities are at that time. And then my last thing is anything that does not bring you joy, pay somebody else to do. Best advice I ever got.
And then
Anissa, I really,
go ahead.
Sorry, I would just wanted to touch on this. What I love that you did is that early on in your career, you took all of the opportunities. So you did a pulmonary critical care fellowship, sleep, and everything. And then later on, once you have this established career and now you have children, you changed your priorities and decided, okay, maybe I'll cut back on this and see if this works for me. Because one of the most common questions I get from medical students and residents is, I don't know if I'm going to be able to have a good work-life balance if I go into critical care or, whatever subspecialty it is. And at that time when they're asking me this question, they're single females with no kids. Yep. And so I don't like that they're already not taking these opportunities because they feel that they need to plan for this magical family that they don't have yet.
Yep.
And so what you did was correct in that you took every opportunity that you could, because I don't think that young women in healthcare realize that once you've attained a certain level of accomplishments, you have choices.
Yep.
So, even in my current job, I don't have children, but if I were to, get pregnant and have children, I now have so much flexibility because I've accomplished so much, within my department. I'm the director of my neurosurgical ICU, and now I have that flexibility to do what I want.
And in our careers, there are so many different paths, guys. So you can be an only outpatient pulmonologist. You can be an intensivist, right? I have really good buddies who work, actually now their group is amazing. They only work 5 days, so they don't work weekends. They have people who just do weekends, and they just do days, and they're intensivists, and they have people who are nocturnists. So they do shifts, they're critical care, but they are out every day by 6. And that's all. I mean, so my point is there's different paths. So do not limit yourself at all. Figure out what you enjoy, and then figure out how to make what you enjoy work for you.
Yeah, and make those decisions once the problem actually comes up. Don't plan ahead for these work-life balance problems.
Yeah.
I think we have time probably for one more question. And before we dive in, I did want to answer to everyone who has asked that, yes, we will be sending out a recording of this webinar tomorrow, and then we will also be sending out the slides. So you'll have that available if you want to share it with your colleagues. But we had another question for you. What if you are advocating for yourself, but you are not heard by your division chief? This particular person said that she has found herself directly or indirectly listing her contributions, but he never seems to hear her. Rather, when she asks for something, only her deficiencies are brought up to decline her requests.
I would go back to maybe my example of getting someone else to advocate for her. So if she has a trusted colleague within the department, have them talk about the accomplishments that she's done to the director. That's kind of what I did with my nurse manager. She sent that email out to my director to advocate on my behalf.
I totally agree with you. I think external validation is helpful, whether and especially if you've worked with anyone at another institution, and just saying, hey, same kind of thing. Hey, can you, if you have a chance, just let them know that what we've done has some value and that my contribution was valuable. I think external validation can be helpful because it's and it's unfortunate that we're not heard sometimes, but it's harder to ignore multiple voices.
It sort of reminds me of, the common problem in Silicon Valley of women trying to pitch to venture capitalists about their companies, and that they have found statistically that men, more venture capitalists invest in male-run companies. And so as sad as this might be, see if there's a male, if your director is male, maybe having a male colleague advocate for yourself may be helpful.
Yeah. Absolutely. I mean, the point is making sure that we are being valued all the way around, and that, the opposite side of standing up for ourselves isn't saying we're only going to look at women. I think you're exactly right? We need to engage all of our colleagues.
And I think we have one more question if we have time for it. How would you recommend making a switch from private practice to academic medicine after being in private practice for almost 10 years?
So I'll start just because I did it, but I did it after only 2 years.
I did the same 2 years.
Oh yeah, there we go. So we can both answer. That's a great question for us. So I'll be brief because I know we only have a couple minutes. I would say before you do that, figure out what your strengths are. In private practice, you have some serious strengths that don't exist in academic medicine, which is number one, probably efficiency. The efficiency of seeing people quickly and efficiently, and understand that. So maybe if you're going to go in, come in with the idea of, hey, I'd be happy to help out with practice management, with helping with workflows. So come in confidently with what you bring to the table, and then make it a very clear message of why you're coming back to academic medicine, because that's going to be their first question, right? Is, you've been in private practice for 10 years. Why academics? Why now? So make sure you feel comfortable with your answer. And I think as long as you're true to your answer and you're authentic, that's going to lead the way.
I second that.
And then we got one final question, if we have time. Any final words of advice for fellows starting the academic medicine job search?
Oh man, that's tough, because the tricky thing with academic medicine, just in general, is that they like to pay fellows very little salary, because they know
everybody
that you've
very little salary.
Correct, but I think they take advantage of fresh fellows more so because you're just used to not getting paid well. So which is why I kind of liked my track where I went into private practice and then came back to academic medicine. But know your market value. Research the different academic institutions in your region. So for example, when I was looking in Los Angeles, I looked at UCLA, USC, and those different salaries to kind of figure out what would be an appropriate salary base.
I think that's super important. And then also I always advise my fellows, remember, money doesn't come for free. So if one group is offering to pay 2 times as much as another group, look very carefully at the clinical hours and the clinical contributions and the required work RVUs that are going to be needed to maintain that salary. I think that balance is important, right? So everyone's expected to bring in their salary. So that's a good ratio. Like, how much work am I expected to do? How much RVUs am I expected to bring in for the salary I'm getting?
And if you feel like and academic medicine and just overall pays a lot less, see what your moonlighting opportunities would be. For example, at USC, I am only allowed to work within the institution with patient-based practice. However, there's the opportunity for me to pick up extra night shifts for additional pay.
Great. Wonderful. Well, thank you both so much. I think that we had some really wonderful pearls of wisdom in there, and all the feedback I'm getting is fantastic. So thank you both. I do want to let everyone know that we have a few more webinars coming up, as you'll see on your screen, and one of our next Women in Pulmonary specific webinars talking about gender differences in diagnosing and treating asthma, COPD, and ILD will be on April 23rd from 2 to 3. That one is also a free webinar, and you can register for it at chestfoundation.org/webinars. And also, those who are still on, please be sure to participate in our survey at the end. That will help us develop better content as